EBP final presentation for NUR 318. This will be on reducing hospital-acquired infections with improved hand washing protocols. Okay, so for the introduction, we'll be talking about the PCOT question. So within healthcare workers who make frequent patient contact, will implementing a new hand washing program compared to the standard one result in a significant decrease in hospital-acquired infections within an appropriate time frame? And the background information is going to be that hospital-acquired infections pose a significant risk to patient and healthcare workers, which leads to increased morbidity, mortality, and costs to the healthcare facilities that it is associated with. The clinical practice problem is that high rates of hospital-acquired infections among healthcare workers are due to ineffective hygiene practices. So the search strategy that I used are going to be years 2018 to 2023. So within a 5-year span, that is how old the articles that I'll be using. It is a full text online. It is open access. It is peer reviewed. It'll be articles. And the number of articles that I found was actually 5. The database that I've utilized in the ASU database will be the OneSearch. The keywords that I have implemented is hand washing, hospital-acquired protocols, and patient safety. Okay. So when gathering evidence, I'll be starting off with the stakeholders, and the stakeholders will actually be the healthcare workers associated with the facility. This will include conducting interviews with collaboration of nurse managers and infection control specialists. So we're not only going to interview nurses, but we will also interview the staff members that make frequent contact with patients. So this could be the physical therapist, the respiratory therapists, admitting physicians that visits the patients frequently. So that is the demographic of the stakeholders. The sample question they'll be asking will be, how do you think these proposed changes impact infection rates long term? So this is a very general question, but this sort of gives us a baseline of what the staff members think about the proposed changes. So when gathering evidence from the patients, it'll occur through focus groups, patient satisfaction surveys, and private one-on-one interviews. And the purpose of this is to find an actual correlation between the new hand washing policies and the number or the percentages of hospital-acquired infections that occurred in the hospital, of course. And we will be doing this gradually over time. And by gathering evidence, we will try to see if there is a correlation between the proposed interventions that we will be using versus the outcomes. So, sample question for this would be, have you noticed healthcare workers adhering to your new hand washing policies? Meaning that, are the healthcare workers or the nurses or the physical therapists, when they are actually taking care of the patients, are they actually washing their hands in front of them, or are they wearing gloves, etc.? So when evaluating the evidence, I have utilized 2 of the articles. The first one will be called, let's see here, 289 Reduction of Hospital-Acquired Methicillin MRSA Bacterium in a High-Volume Adult Burn Center. And the research design for this will be is that they use an interrupted time series with concurrent controls. The second article is called Improving Hand Hygiene in a Rural Critical Access Hospital. And the research design for this article is that The main purpose of this research study is to increase the frequency of healthcare workers adhering to hand hygiene protocols. So the sample and setting for the article number 1 will be that adult patients in an ICU setting in a burn center, and specifically ICU setting for burn patients, which is called BICU. Article 2 will be a clinical and non-clinical staff working in a 7-bed emergency department in a med-surg setting based off of a hospital in rural critical care, North Carolina. Data collection methods for Article 1 will be examining MRSA colonization in high-touch surface locations, patient's history of pre-existing and/or hospital-acquired MRSA infection, and the utilization of chi-square tests to collect data after interventions were taking place. So these data collection methods, there's a variety of them. And for Article 2, they used a PDSA test cycle throughout the 3 months of gathering data. But for the data collection method, they actually hired specific workers to gather data from the healthcare workers. So that is how they gathered the data. So for Article 2, results for Article 1 is that there's a significant decrease in MRSA colonization in BQ and ICU settings, and the hand hygiene adherence rate in med-surg unit increased to 70%, ED increased to 81%, but they still fell short of their 90% outcome. And this is for Article 2. So both of these articles have succeeded in some way of adhering to hand hygiene protocols and preventing hospital-acquired infections. So the main summary of the study is that for Article 1, the entire point is to decrease the MRSA infection at a BQ unit. And for the interventions, this includes UV light disinfection, hand hygiene protocols, bed rotation methods, and other more. The big one will be the hygiene protocols, so hand hygiene specifically. To collect data, MRSA colonization is observed at high touch surface areas, and colonization rates will sort of be observed. So, in conclusion, there was a significant decrease in MRSA in this BQ setting. For Article 2, the main purpose of this research article is to increase the frequency of healthcare workers adhering to hand hygiene protocols. So, obviously, that is our goal for this sort of EBP project, and this is done in the medical surgical unit at a rural hospital over at North Carolina. And the interventions that are utilized are the ones that I personally would propose. This can be such as putting up posters at the hospital to remind the healthcare workers to wash their hands. So reminding the hand hygiene protocols to staff members by the nurse leaders, etc., etc. The conclusion is that there is a significant decrease in hospital-acquired infections within the facility, but they still failed to meet the expected outcomes of 90%, according to the article. So, and obviously both utilize a level 3 quasi experimental design method. They are randomized. So, for the appraisal study, the limitations for Article 1 is that they fail to address other complications or events that could have skewed the results. So they did not acknowledge any of this. The study did not also acknowledge measurement biases. Right? The strengths is that there was a significant decrease, but the study should have shown changes such as hospital cost reduction, length of stay decrease, and patient mortality rates, which they did not mention. Relevance. Hand washing correlates with a decrease in hospital-acquired infections. So, limitations for Article 2 is that the study was conducted at a single hospital, which limits the demographical data, ethnic groups in the study. So, it was a single hospital. The study for Article 2 is that they utilize strong evidence-based practice by using bioluminescence arrays to provide data. So they use actual evidence-based practice, and they try to look at the MRSA colonizations, which I found very interesting. The evidence is relevant because the healthcare workers must treat their patients as if they're sick or immunocompromised, so they're using safety precautions, and which is a big thing in healthcare. And it is important for the healthcare workers to adhere to hand hygiene protocols. So they are doing this and taking this seriously. So for the implementation plans, I propose that there are more access to hand hygiene stations throughout the facility, an implementation of a reward system for staff members so that they are encouraged to do these things, conducting frequent surveys of both patients and staff members to gain feedback and to sort of grow on this hand hygiene protocols that we are going to implement or have been implementing. The clinical expertise is that the development of mandatory hand hygiene course for appropriate staff members. So we could implement a program at the facility or a course module for all nurses, techs, physical therapists to take so that they'll be educated on these matters, right? And then obviously we could scatter posters around the facility just reminding everyone, hey, we need to wash your hands, etc. So patient preferences and values. So the integration of patient preferences are crucial. This creates an environment of safety and comfort and taking consideration of holistic care, such as patient sensitivities and allergies. So we're trying to, as a nurse, we are reliable for patient holistic care. We are not trying to cure the disease. So we have to remember that we have to take care of the patient's preferences and values, which is part of holistic care. So for the communication and marketing, we propose that new changes and ideas in team huddles and staff meetings. So we're going to do these sort of meetings to touch base with our coworkers, see where we are, what improvements we can make. We can distribute posters, educational materials, and graphically appealing flyers to both patients and family members to spread the importance of hand hygiene. We can hire new staff members, such as infection control specialists, to sort of just advertise and enhance hygiene protocols to show the hospital. We do have foot soldiers going around that are marketing and communicating with the patients and the nurses and the healthcare workers that hand hygiene is important. And we can also create a digital website and promote it there. So for the monthly audit, so for the evaluation plans, monthly audits from nurse managers, hospital, house supervisors, or any nurse leaders are necessary to touch base with the staff members regarding new hand hygiene protocols. So we'll get these guys to sort of just evaluate what has happened, what we can do better, or what we can improve on, etc. So we can also conduct surveys and interviews like we talked about with the healthcare staff and the patients to consider feedback. And this is sort of a democratic leadership to gain everybody's opinions on the matter, right? It's not just going to be the important people that are part of this decision making. So it's going to be everyone. The evaluation of data will be the is there a length of stay for the patients compared to the before and after the intervention? So has it been shortened? Has it been increased? Is there a significant healthcare cost reduction? So patients are getting sicker. They're going to have to stay in the hospitals longer. We're going to have to use more resources. So based off the second article, we can utilize the bioluminescence arrays, which I found very interesting, to assess for MRSA colonization, so etc. And for the conclusion, hospital-acquired infections are still very, very dangerous, and we have to take this seriously. We can use evidence-based practice, like in Article 2 and 1, to measure the effectiveness of the current protocols and whether we need to change it or not, whether we need to further research to validate and improve the current practices. So we just talked about. And different facilities, we can see what other facilities are doing. We could take their ideas and other stuff like that. So, all right, and these are my references. And thank you. That is the project.